Coronaviruses are a large family of viruses, some of which can cause diseases in humans and animals. There are over 200 types of coronavirus, 7 infect humans. 4 are endemic, meaning they regularly affect humans and cause around 15 to 30% of common colds each year. 2 of them caused the SARS and MERS epidemics. The 7th is the newly discovered Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2, responsible for COVID-19, the first coronavirus disease to be labelled a pandemic. It is the virus we've all been dreading because it combines a high attack rate with a high mortality rate, a combination we haven't seen since the Spanish flu of 1918, and we haven't developed immunity to it because it's too new. Estimates of lethality range between 1 and 3.4%. Lethality appears to depend on the demographics of the population and on whether emergency services in the locality can cope or are overwhelmed by the outbreak. In Wuhan, where it is believed the outbreak started, health and other emergency services were taken by surprise and completely overwhelmed. The fatality rate there reached 12%, whereas in China as a whole, containment was relatively successful and health services weren't overwhelmed. The fatality rate was around 0.9%. On the other hand, in Italy, where a higher than average proportion of residents are over the age of 65, the fatality rate is unusually high, around 10% as of the 25th of March. This is why governments around the world are encouraging social distancing now that containment has failed, in order to spread out the impact of the pandemic, so as not to overwhelm national and local emergency services. Globally, about 3.4% of reported COVID-19 cases have died. By comparison, seasonal flu generally kills far fewer than 1% of those infected. Luckily for us, the new coronavirus isn't mutating quickly. The 104 strains of COVID-19 virus analysed as of mid-February 2020 showed no significant mutation, with a 99.9% similarity. This means that if things were to continue that way and we discover a vaccine, it is likely that the vaccine would continue to be effective for as long as it would take to develop newer and more updated vaccines.